Lagi ka bang may dandruff, pamumula, o makating anit? Hi, I'm Doc J, board-certified dermatologist and hair specialist here at DERM.I.S. These two conditions may look similar but are totally different: seborrheic dermatitis and scalp psoriasis. Scalp conditions that presents with persistent flaking but have different treatments. Seborrheic dermatitis is caused by excess oil production and growing yeast on the scalp, and it is usually triggered by stress, change of weather, and excess oil on the scalp. While psoriasis is an autoimmune condition that presents with persistent red, thick, flaky plaques on the scalp. So what can I do whenever I experience itching or dandruff on my scalp? Well, as a first line of treatment, you could actually apply medicated shampoos such as selenium sulfide or zinc pyrithione. These are available over the counter. However, if dandruff, redness, and the itching is still persistent, it is best to consult a board-certified dermatologist. In the clinic, we usually differentiate seborrheic dermatitis and psoriasis. We use a dermoscope to check on the scalp, to check on the different patterns of the flakes and the redness on your scalp. This would sometimes help us determine if this is seborrheic dermatitis or psoriasis. However, there are some cases that we need to do a skin biopsy and send it to the laboratory for dermatopathologists to analyze whether this is seborrheic dermatitis or psoriasis. How do we treat these conditions? Well, there are different ways to treat seborrheic dermatitis and psoriasis. For seborrheic dermatitis, we usually give antifungal shampoos and topical anti-inflammatory agents to control the redness and the itching. In severe cases, we really have to give oral antifungal medications for this patient. On the other hand, when it comes to the treatment of scalp psoriasis, this may be a little bit tricky because scalp psoriasis tends to be persistent as it is a autoimmune condition. Aside from topical anti-inflammatory agents and keratolytics and shampoos, we also sometimes give oral medications to control the immune system, hence helping with the psoriasis. As a precaution and disclaimer, do not self-medicate as this may cause more harm than good. So whenever you have persistent redness, itching on the scalp that does not go away with over-the-counter medication, always consult a board-certified dermatologist. If you wish to have your hair and scalp treated, visit us here at DERM.I.S and we'll be happy to help. Till next time, bye!